At KSMO Radio, it's time for us to sit down with our friends from the Salem Memorial District Hospital. We have Bill May in, the interim CEO. Your time's about running out, sir.
Yes, it is.
You're getting near the end.
About 10 days away, I think. Going to head back to sunny Oregon and see what's going on.
Yeah, you don't like all the rain out here in our area. I can tell you that much. And we have a newbie. We have Joann with us. Hi, Joann.
Hi, how are you?
Now we can get closer to you. That way, don't worry. Joann is our new. Are you interim CFO or are you CFO?
I am interim CFO.
Interim CFO. Well, very good. Well, we welcome you. And
Thank you.
Joanne's going to give us the numbers. She's going to give us a whole bunch of numbers,
That's
I'm
right.
sure.
That's right.
That was very good. Well, thank you for coming in. We do appreciate your time and your efforts in helping us put our hospital back into shape. Very good. Well, Bill, it's been a pleasure to have you.
Thank you.
2 out of our 3 chances. Don sat in on you
Right.
last time and
Right.
filled in for you. He did a very good job along with Ashley and Doug, and so we really appreciate our hospital keeping us informed, and we're bringing it to you so you know exactly what's going on. You know, no sugarcoating. We just kind of tell it like it is, right? That's been your philosophy since you got here,
That's
right?
exactly right. I mean, you just need to let everybody know what's going on, the good and the bad. And I think we're making great progress.
I think we are too. So let's go ahead and let's start talking a little bit about the board of directors meeting. And of course, I was unable to attend. I was doing a baseball game, so I got my next best person to go.
You bet. Yeah, absolutely.
But we had to swear in a new board member, didn't we?
We did. Yes, Wanda Tatum joined us, and I'm sure everybody knows Wanda. She's been around in education, I understand, maybe 30 years or so, and I think she'd be
Quite
a great
long.
addition to the board. So, going to miss Dennis. Dennis has been with us for 34 years.
Like a
and,
fixture, isn't
He
he?
really is.
Yeah.
He told us the other night, I think he's only missed maybe 1 meeting in 34 years. Hard to believe.
Yeah,
It really
he's
is.
always seemed to be there as far as I can remember, and I've been at quite a few of those meetings.
Sure
but
you
not,
have.
not 34 years that he has been, but I've been there for over 25 of those,
Wow.
and he definitely has been a fixture. I mean, I'm surprised there's not a seat named after him. You know, he always used to sit in the same seat until he
That's
became
right.
president, and he didn't like it. I could go. I don't want to go to the top of the table. But then he always had his favorite seat.
We're
but that's
going to
good.
miss him. He's a great guy.
He is, and very knowledgeable, and his love of the hospital just can't be denied.
that's
And
exactly
that's the
right.
neatest thing. So we really like that. So, well, let's move forward, because once we get the legal stuff out of the way right there, then we get the chance to start making some decisions. So I guess I'm going to talk with you, Joann, because we had some numbers to go over for the previous month. When the numbers from operations come in, we're not always so happy with it. But one thing I like to look at, too, is cash increase or decrease for the month. So when you look at the numbers, not really good looking on the operations side, but nice increase in cash on the other side.
We have had a decent increase in cash, and as of March, we were sitting just at 5.2 million, but as of today, we have topped that, and we're at 5.8 million, and our cash days on hand have increased to 70 days.
Wow, that's fantastic. That's fantastic. So do you want to go to statistics when we go to statistics with Joann or you, or just go over the numbers, the financial numbers with her?
Why don't we do the financials, and then I'll be glad to talk about the stats.
Very good. Let's finish on the financials. So deductions from revenue continue to be high. We all know that. A lot of those are just contracts that you have, Medicare, Medicaid. They do take their fair share, don't they?
They do, and a lot of it is, cleaning up our old AR, and so we took a significant hit this past month doing that. We're hoping that it will not be as significant moving forward, but it was something that had to be done. It did decrease our AR and our days in our AR. It was just something we needed to do.
Well, it's been needed for quite some time.
Yes.
I actually remember one time we had it in our days in AR was 39, and I said, you better just take a photo of that because
right.
that won't happen very often. I said, usually you get a big bulk payment, and that usually puts you at that number. But normally but you would probably say, I always think with advertising agencies like with radio, it's 55 to 65 days, usually in there, because by the time you submit your bill, send it out, by the time they get it processed and get it to the people who need to pay it, It's usually about 45 to 65 days.
It is, and you know, in a perfect world, we'd like to see 45 to 50. Right now, we're holding steady at 66, though, so we're doing good.
We'll take 66. And much better than the 81 or 2 it was.
Or the 102.
You know, we don't want that. We don't want to remember those days. Joann, don't bring back bad memories.
Okay.
Only bring back good memories, okay? That's why we're here. But when we look at the financials, though, as you mentioned, you got to clean up the AR, and that's going to take an effect on the balance sheet as well as on the financial statements. So as we look at a gain from operations or loss from operations this month, we had another loss.
We did.
Significant one. Lab was still not in full force yet.
It is not, and we're getting there. We're just about to be finished. We're drawing some final blood, and then we'll be moving forward with that.
And Clea's coming back in when, Bill?
We hope in a couple of weeks. Yeah, I talked to them actually yesterday, and we should have the blood work done here by the end of the week, and then hopefully in 2 weeks she'll be back.
That'd be great.
It's unannounced, so we don't know when she'll
Oh,
be
yeah,
here.
well, yeah, they kind of show up when they want.
Right.
Yeah. What would be the purpose of telling you I'm coming, right?
Yeah, exactly.
Yeah, they wouldn't do that. But, you know, then we still have some tax revenue. So overall, though, you still have a loss for the month when people look at that. And I think, you know, sometimes people just don't understand. You're going to have those months where the expenses are high. We still have some high expenses. We're still purchasing things. And cash does go down.
Yeah, we did a phenomenal job collecting cash. We collected
That's the good point.
2.2 million, which was the goal, and they exceeded that by a little bit. But we did clean up our AR, and in doing so, we had a little bit of a loss.
We have a little bit of loss, but as I mentioned before, when the cash that you're taking in exceeds the cash that's going out, that's a good thing, and that's exactly what happened in March, didn't it?
It did.
To a tune of $800,000. Is that what I'm reading correctly, or 600?
It was 800,000 and
55,000, 855,000. That sound about right?
it does.
I believe so.
Nothing wrong with that. So the loss from operations was actually what happens during the month of March, but the cash that came in has been billed over all this time, finally getting it in and getting those bills paid, and then keeping the hospital moving forward. Thusly, as Joann was saying earlier, our available cash has gone up. That's always a good thing. When we look at payroll numbers have been down a little bit because obviously the hospital has reduced staff, and so that's starting to show up, and that helps keep numbers in control. So we look when we look at the numbers in anything outstanding on that cash flow statement or on the financial expense comparison, Joann, that really stands out. I think the one that if anybody would look at these numbers that would just probably jump out at you would be the insurance, which the current insurance is $124,000 and it was budgeted at $26,000.
Well, and a lot of that is we switched insurance carriers, and so when you get to a new plan, you know, all those claims have accrued. You have to have the claims in January and February, and we finally got billed in March for January and February claims with a new insurance carrier. And so really, had those been expensed in the month that they actually happened in, then you wouldn't see such an increase.
Right. But as you say, when you switch, everything comes to fruition all at one time.
All at one time.
Yeah, and it has to be paid. And that's why I say sometimes when people just look at statements, there's usually a fairly easy explanation as to why that number is so skewed, right?
Yes.
You know, and in this case, right there. Now, we also know that we have still contractuals and still working through those, but they're getting much lower than they were in previous months. And last year, this time, we had $306,000 in contractuals. We're down already to $278,000. That should continue to be reduced, but we still have to have some temps, don't we? We don't have enough staff in areas like the lab and stuff, so you're still having contractuals out and about, aren't you?
Yeah, we still have some people in the lab, and we're still having to send some of our tests out for analysis, so that's still keeping our costs up.
So, and we're hoping in the next couple of months we'll see that start to drastically change.
Exactly.
Very good. All right, so good. And when I look at the numbers as far as the cash flow statement, looks good. I mean, a very solid cash flow statement. everything under control. And we see the self-pay on the insurance costs, Medicaid, Medicare, and the receipts, and the other money coming in. You help keep it very fluid, and we always like to see that.
Yeah, we're trying to control our cash efforts a little better than we had in the past, and we are increasing our days in AP and just controlling cash overall.
And very good. And that's done a great job, too, of keeping the cash under control. So, I didn't see anything on the expense comparison that stood out except the insurance. And anything you need to explain there or that you feel needs to be explained?
No, I think some of the things that, we see that are a little over for this month, you'll see those go down in the next month or so as we get the lab back on track and as the insurance claims smooth out.
All right, very good. I saw the other current assets added to the balance sheet. That was used to be CDs and things of that nature. Would you like to explain what the total other current assets are currently?
Well, we currently have $600,000 in other assets, and we are just trying to keep our liquidity up.
Right.
And so, just so that we have that available cash.
We had to dip into it, didn't we?
We did.
We had $2 million in CDs, and we had to cash them in to stay liquid. And that's really was the reason why having that $2 million in CDs was there, just in case you needed it.
Just in case.
Yeah.
And we needed it, so very good. So $5.8 million in cash right now.
As of today.
We're up to, what did you say, 70 days?
70 days cash on hand as of this morning.
Fantastic. That's fantastic. Critical access is what, 63 an average critical access in Missouri?
Mm-hmm.
So
That's correct.
Very good. Keep moving forward. We'll leave it in charge of your capable hands.
Well, thank you.
We're pretty excited. Considering where we were 2 months ago, those numbers look pretty good.
Oh, yeah.
They do.
They look very good. Keep collecting that money, right?
You
Yes.
bet.
Yeah, a lot of it was late getting out billed, and I know that makes it even harder to collect when people forget what services they had, and
That's right.
then you have to collect it, and they tend to throw a little hissy.
Every once in a while.
Yeah, every now and then. Well, if you're not billed, like I said, you do forget about it. One of the nice things the hospital has offered in the past is that discount up front,
Right.
and within 30 days, and that does help turn a little bit of cash over. But hey, saving money anytime you can for the patient, that's a great asset to have that our hospital has always offered, and we really appreciate it.
And I think, Stan, too, that one of the things the hospital had not been doing up until just recently was we were not collecting any money up front when a patient
never.
walked through for outpatient work or whatever. We're like a dentist office, you have to pay, your copay when you walk in.
Right.
And we're beginning that now, so that's going to be a little bit of education on the community's part for us to kind of work with the community that we're gonna start asking for that moving forward.
Yeah, it was that was brought up at a board meeting. I remember it was discussed a little bit. So yeah, well, you have to pay for the services. There's a deductible for everything.
Yeah,
So
that's right.
So you got to make sure it's paid for. All right, very good. Well, Joann, thanks for that data. We may refer back to you here later on. So don't pick up and leave. I do thank you for that being there. So let's move forward, and Bill, I'm going to let you talk a little bit about the summary of the operations,
Sure.
if you would,
Be happy to.
and let's just kind of talk a little bit about that. And
Okay. Yeah, we, as we spoke at the board Tuesday night, the inpatient admissions for the month of March were up a little over previous month, and that's a good sign. Probably the biggest jump for us was bringing back the swing bed program back in February, and we're to the point. Good morning. We're to the point of.
just have people dropping in.
We
from
do.
everywhere.
That's good. Good morning.
Good morning.
How are you, Shelley?
Good. Hi.
Good.
So
Shelley's joined us. Shelley is our new nurse practitioner. Shelley Bland.
Sit right down there. I'll move this to you. We accommodate other people. Would you like some water or anything?
No, thank you. Thanks. Good to be here.
What, 3 weeks now? Is that what
3 weeks in, yes.
3 weeks?
Yeah.
So Shelley's going to start seeing patients on May the 2nd. and in the clinic.
Yeah,
And
schedule your appointments.
That's
Yeah,
right. We're
very
pretty
good.
excited that she's with us. So
Very good. And
She's,
she brought a nice offspring to help us out too.
that's exactly right.
That's great. Yeah, I had a
Thank
chance to
you.
interview her right after the first of the year. She's
Yeah.
fantastic young lady.
I think so, but I'm partial.
You might be a bit biased. Yeah, well,
Just a
but
little bit.
that does happen occasionally. That's okay. That's okay. Well, we're going to get to some stats first, and then we'll get to you.
Okay.
Shelley? Very good. All right.
So as I was saying, the swing bed program has really been a boon for the hospital. Just as an example, in March we had 175 swing bed days, and that compares to 64 a year ago. And what that means financially for us, that's about $178,000 of new revenue that we had in the month of March that we didn't have last year. Wow. It's a program that critical access hospitals have, and really is kind of what pays the overhead, if you will. So that's been very positive. This morning, as an example, we had 13 patients, and 8 of those were swing bed patients this morning.
Okay.
So
Very
very
good.
strong, very strong. Outpatient registrations are still down a little bit. Part of that is simply because the lab is down, and that will pick back up. As I told the board Tuesday night, ER visits are up for the month of March, which is good. We had one of the stats that we look at that the Centers for Medicare and Medicaid like for us to take a look at every month is how many admissions do we get out of the emergency room for the as it compares to the total number of admissions. They like to see about 10% of the folks who come through ER be admitted, and we had just a little over 10% in March,
that's great.
which is good. Again, that's a kind of a new number that the board had not heard before. So overall, things are going well. You know, we're doing a lot of tweaking, as you do. I mean, my to-do list is about 2 pages long. So when I leave May 6th, it won't be all erased, but it'll be in good hands. With Don.
It'll be in paper, right?
That's right.
So
that's
somebody
right.
can't say I never saw it.
Yeah,
that
Don
does
Babb
happen.
is currently aware of it. So Don will be.
and like you're saying, Bill, a lot of things when you look at the medical field, you look at percentages. I always looked at, for years and years. Okay, we have acute care patients per day. We can figure that out. And then when you take a look at the graph, it just 1 week there's hardly anything, and then the next week it's just jam-packed. And so when you look at an average, it sometimes hides the facts that are there. One of the things I always saw when I was looking at things was especially for our ambulance services that go out. They respond to a call. They don't have any idea if somebody's hurt or not. They have to go out there. Now, they may be canceled en route, but they still had to get prepared, get in the vehicle, take off. And a lot of times there was 2 ambulances called if there were 2 vehicles involved in that crash. And may not be used, but they may be used. And then what I always saw was coming out to about 2/3 of the calls, they were dry runs.
Yeah.
Now how much, and I remember bringing this up at one time quite a few years ago, how much does that cost the hospital for that dry run? And that cost has to be built back in. Somebody's got to pay for it. There's maintenance on the ambulances. There's time, the equipment that has to be used. And if it's a dry run, they're out there waiting and they're taking themselves away. That's an opportunity cost that they're not serving somebody else.
That's correct. I mean, we had 66 dry runs in March.
Out of 200?
Well, we had 200 runs. That's correct.
Well, there you go. That's exactly 33%.
It is, without a doubt.
Oh, man, my math is so good. I better not
You're on top of it this morning.
But those are things that you see in the medical field that you just can't sit there and just discount.
Yeah. And you, unlike other departments of the hospital, you can't flex that staff.
No.
They've got to be there 24 hours a day.
Right.
Where if in lab or radiology or wherever, if they're not busy that day, you can flex your staff and have them go home and then come back if needed. So, but with ambulance, of course, you've got to have them there 24/7.
Exactly.
Yeah.
And to
You
not
just
take
speak up.
away,
You don't have to raise your
just
hand.
not to take away from stats and stuff, but when you're in that percentage, if you're the one or you're the family member of the one that was saved, I mean, stats don't even matter, Like my husband, I mean, he was in a 4-wheeler accident and he's here today because of quick acting.
Right.
So, like I said, then those stats go out the window for that person.
Yeah. Calm and cool wins that race.
Yes.
If you panic, you usually do worse than trying to do
Well, and as a family member, I was a nurse, but I panicked.
Well, you're not expecting it. That's
No,
the whole thing.
exactly.
You're not expecting that to happen. So when it does happen, you're kind of like, you have to take that break.
And that's just the thing with the hospital. We need that access to care. We need it. It's
Absolutely.
vital.
Key ingredient to our community moving forward. Absolutely. If it's
Exactly.
not here and not thriving, we don't grow.
Right. And you don't know what you're missing until it's gone. So
We don't want it gone.
exactly.
Exactly. No, we're moving forward, and Bill and his crew have done a great job. And
Well,
we're
thank you, Stan. We
continue
appreciate it.
Continue to move forward. But when we look at the tests, like you were mentioning, laboratory tests down, basically the lab, all the normal bloods. And when people are starting to already talk in May, I mean, I know they're getting anxious for those health fairs.
Right,
You know,
right,
and I know
yeah.
that the goal of the hospital is to get those regenerated again, but one step at a time.
That's right. Once that lab's operational, we're ready to go.
Yeah,
We're
so-
preparing for that now.
So I keep hearing that. And I thinking, 2 more steps forward to getting back to a normalcy that I think a lot of people have missed for the last 3 years.
That's correct. Yeah. I guess a couple other things, Stan, that
Sure.
I'll bring everybody up to speed with. We've obviously been interviewing CEO candidates. The board has.
I have to decline.
We have one more opening, so you're welcome to come over.
If I didn't have to call those baseball games, I'd be there.
Put all those games at night. You can come on over and work during the day and go to baseball at night.
Unfortunately, I had to 8 o'clock, and you guys started at 6. No, I think I caught you off guard on that
No,
one, didn't I?
I had to think about that a minute.
Wait a minute. Was he on that
You know
list?
this business pretty well, so you can probably step right in.
Well, probably not quite as good as you do.
Well, the interesting thing about when you start recruiting CEOs, and we've done this for years, our company has, and we put out the ad for CEOs and ended up with 130 candidates that applied, and we kind of narrowed that down over the course of the last month or so, and the board has now interviewed 3 candidates, and we've got one face-to-face interview on Saturday. The board's going to interview an individual actually from Missouri, and then we're going to do a Zoom interview with another fellow up in Kansas. So we're hopeful that we're able to, the board's feels good about one of those candidates who may be able to bring them on. It'd probably be 60 days before they would.
Well, that's fantastic.
So
though.
we're excited about that opportunity as well.
Well, as we mentioned, you got to inch forward just to get to
That's
that
right.
next goal.
Yeah. Well, and probably the biggest news for RHG, and I hope the hospital, is, we've been talking with the board for a couple of months now about what we do at the end of our 90 days and so on and so forth. The board did meet the other night and talked about that in closed session. And long story short, they've agreed to keep us on for another year. So we've extended our agreement with them for another year. So the progress that we've made will, I think, just be able to continue and move forward with that as well. So.
Well,
we're excited to be a part of the
But you're
community.
probably not going to be here very often. But when you stop by, we always want you to stop in and say
thank
hello.
you. Thank
know.
you. I'll
Don't
certainly
become
do
a
that.
stranger up in Oregon and then tell us you're too far away. That's a hogwash.
No, I'll be back and forth.
Yeah,
without a
there you
doubt.
go.
So,
No, I know. You'll keep your thumb on the pulse of SMDH.
certainly will.
I know
You
that.
bet. You
I can already tell that you have things in your mind already. That's
well,
what I caught you off guard. That's
yeah,
great.
you get invested, you know,
do.
and when you work with that many people and get to know people, you kind of want to make sure that the future looks bright, and I believe it does.
Absolutely. And I still see some good news with rehab. It's still right where it belongs. And, of course, home health will just continue to get bigger and better. We already know that they're one of the quality home health organizations in the area.
Right,
Exactly. And I know Ashley has left that in good hands.
They do a good job.
And
They really do.
she has still got her thumb and pulse on that, too.
Yes, she
That's
does.
like her baby. Don't come in here and mess with my baby. Anyway, but that's why I say the people in the hospital do a tremendous job, and they take the responsibilities that they're given very seriously and make sure they get done right. And I think that's the whole thing, just coming and doing a job and not knowing if it's done correctly or not and then walking away. It doesn't provide anybody anything because nobody can follow up on you and find out what you did.
That's right. That's right.
So,
yeah.
anyway, nice, good numbers there. I'd like to see long-term care field back up again, though. How are we
I think
standing
we
on
had
that?
We are at 18, but one of our patients is in the hospital today.
Okay.
So
So we're
So,
full again.
We're full again.
again.
You
Yes.
know, okay, just waiting on them getting back. Well, very good.
Exactly.
Always good to see long-term care unit stay full. It does provide great service to those who really need a little bit of love and attention.
They're phenomenal over
Yeah,
there.
They are. They are. I always just tip my cap to them because they've done a tremendous job over the years, and I don't see that changing anytime soon. All right, very good. As you mentioned, though, when you have an issue, outpatient registrations have been down. We want to, if you have something with whether it be MRI, CT, something of that nature. Don't put it off. Come on in. The labs have nothing to do with that. You can go in and you can get that done if you need that surgery, or if you need to, before your surgery, to have something checked. You know something's wrong. Why are you letting it bothering you when you have a facility here that has not only the best MRI in the area, hands down, nobody even close, and we're getting a new CT scan.
That's correct. Yeah.
You've got outstanding ultrasound equipment. You've got all this equipment, the top of the line stuff that's here at a small rural hospital, and at affordable prices that if you want to shop, dare you to. Go shop. Find a better price.
And what is the weight capacity on that CT scan?
700 pounds.
That's amazing.
Yeah.
Like, that's not even found
Anywhere.
Yes.
Yeah. It's going to be a great machine.
Yeah.
It really is.
And
We're
that's
pretty
why,
excited about
when people say you're just a small rural hospital, bet me.
yeah, that's right.
We can do more. I mean, I know when, and I brought it up last time when my dad was in the hospital and getting kind of passed around a little bit. You really realize that you don't know as much that you think you know when somebody goes in. You try and kind of maybe, I don't want to say bluff your way through it, but when you're hearing what the doctor has to say or this, and then you're wondering, why aren't they getting those tests? Sometimes there's a reason. But other times, if you know you've got something hurt in your knee and you need to have something done, get it done. Don't keep putting it off, because it's only going to get worse on your knees.
That's right.
Or on your back or wherever. Get that MRI or get that CT get done. Talk to your nurse practitioner or your general practitioner that you might have, and let them take a look at it. But if you need something done, get it done. Get it done local. It's cheaper and it's efficient.
Well, and the cheaper, I was just going to mention that. We're getting ready to roll out this week, actually. Bobby Sullins is in radiology, a cash price for everything that we do in radiology. And
I heard about that. I was very impressed.
It's going to be phenomenal. It really is, because some people don't have insurance, and to come in and spend $3,000 or $4,000 for something that we can discount pretty heavily, if they want to pay cash, we're going to roll that out, and we'll start talking with you about it as well. You can help us get that message out.
I will be more than happy to get that message out. And now there is transparency in the hospital where people can go on and price services.
That's correct.
Correct. Now, will that cash price be somewhere in that transparency?
No, we probably won't do that.
That would probably be a good idea.
That advertising thing gets a little hazy when you do that on that cash price. But
I would have to think insurance companies and stuff would be monitoring that.
Yeah, as long as you're at the Medicare prevailing limit, you're okay. If you want to drop below that, Medicare gets a little fussy. So we're certainly where we need to be with that.
But like the hospital, as we talked about earlier, on their within 30 days, they offer you a 25% discount if you pay within that time. That's basically offering the same idea.
That's correct.
So you get a discount being there. So very good. All right, so let's put a little star above Bobby's head.
You bet. No, Bobby came up with that on his own, and I'm very impressed. I really am. You did a good job with
we have an outstanding radiology department. Bobby Sullins does a tremendous job over there, and he is one that if you have a question, you will get an answer.
That's correct.
That's correct.
That's always neat to have. All right, very good. You want to move through that to the staffing and see where we stand, Bill?
Staffing continues to be an issue. It is across the country. In our own hospitals, it's an issue. Probably the two biggest areas is lab and nursing. We just we made some salary adjustments back in March, which I think will help a little. We've hired, I think, 3 additional people. We've had, as you always do, a little turnover as well. But I think we have 4 openings right now in nursing, and we actually have 3 new lab techs coming on Monday, and they will be fully staffed at that point. So that's great for us to be able to do that.
Yes.
Other than that, all the other departments are in pretty good shape, I believe, at this point. So we're happy about that.
All right. So I know Ashley Sullins had mentioned she's your chief nursing officer. Ashley was to be here, but she's slaving away on the floor today. So that's okay. She's a lady of multi-talents. I'm going to tell you that much. But there was an issue with some dress code that was prohibiting some people being able to be hired because they didn't meet a hair clause in our dress code, right?
Yeah, our dress code is pretty restrictive. Has been pretty restrictive, and
It has been for years.
it has been. That's correct. They told me I needed some more hair, but
Did it work?
no.
No wonder why you're leaving.
But no, we had an excellent nurse that applied a couple weeks ago and happened to have a little color in her hair, and there was some concern about bringing her on because our dress code prohibited that, and we met with the board the other night, and the board was kind of a little bit aghast, I think, and saying this is 2022 and we need to change that dress code. So we're going to relax that and be able to bring those kind of folks on board. You hate to lose a good nurse.
Yeah,
over
oh,
something like that.
absolutely. And if they want to have a streak of red in their hair,
I'm fine.
I mean, that's an individual preference, and should
right.
have nothing to do with their job
No,
performance.
not at all.
So, I mean, and in helping that, in talking about the staffing crisis, well, we had a lot of overtime hours that had to be put in by nurses last month, right?
We did. We had about 100.
105.
Yeah, 105
Wow.
overtime hours. And what we've asked the nurses to do is pick up an additional shift every 2 weeks. And when they work an additional shift, of course, part of that shift is overtime.
Sure.
So that's the reason. That's the reason it's important to go ahead and try to get it fully staffed as quickly as you can.
Right, and what we just went through with COVID, if somebody gets ill or can't participate, then all of a sudden you have nursing shortages already.
That's right.
Now you become at a critical level, and then you're all of a sudden contracting out nurses at a much higher price again, aren't you?
That's exactly right. And the other thing we're doing this week, and has not been, we're not advertised this yet. Our minimum wage is below $15, so we are increasing our minimum wage to $15 effective immediately. And we have some departments, 2 or 3 departments that are below that right now. So all of those individuals will be getting raises actually next week. So we're happy about that because we should be competitive, and when you're at $12 or whatever, that's not very competitive in healthcare anymore. So, yeah, we're happy to bring
The
that.
CEO job still available? It's $15 an hour. It's more.
You have to work a lot of hours, but yes, it is.
Trust me, working the hours, I do that already.
That doesn't bother you a bit.
No, not a bit. It'd probably be less than what I do now, but that's okay. No, I really, really appreciate that. So that'll cut back on the cost, allowing these other nurses to come in, keep that contracts down, and also help keep the overtime down, and
That's
give
correct.
and increase the flexibility that the hospital has with their nurses. Correct?
That's for sure. When we came in February, we were running about 5 patients a day on average, and now we're averaging about 15 or 16. So, again, part of that's a swing bed program, as I mentioned earlier. So, yeah, we're very pleased about that.
Well, the nice thing is, in the COVID-19 update, is we don't have any.
No, that's right. No, we
like
haven't had
that.
any.
That's
for
wonderful.
A couple months now. So
Yeah,
that's
I like
great.
that. And everybody that you have there is either vaccinated or approved exemption, so there's no
That's right.
still flies in the ointment out there. Everybody is right where it's supposed to be. And the community exposure has been it's in low,
Yes.
and that's fantastic. So moving forward. So as we move to the hospital foundation, obviously we have the golf tournament coming up, and they are accepting sponsors. If you know somebody out there that would like to be a sponsor of the foundation's golf tournament, they do always can use an extra sponsor or two. I know we do the hole-in-one competition, so hopefully nobody gets it. No, that's not true. I would love to see people get the hole-in-one. I would love to get a hole-in-one myself. Won't happen. But unfortunately, Chris Holliday, who was your chairman of the foundation, has resigned.
Yes.
He's doing a lot more work in Rolla now.
That's correct. Yeah, the golf tournament's the 3rd of June, I believe. And as I understand it, I haven't seen that event yet, but I'll be there for that event. I understand it's a great event for the foundation.
It is.
So we're going to hopefully have a full house again.
All right. And if anybody has any questions, just call the hospital if you would like to get your foursome in, and they can get you the application out to you. They can mail it to you, fax it to you, scan it, send it to you, however you want to receive it, and fill it out and send it back in. And, of course, they'll be more than happy to answer any questions you have about the golf tournament. It'll be out at Spring Valley golf course out here in Salem. And it's always a good event. Great food, great people, great time, and hopefully great weather. We got lucky last year. We were able to get it in, but not by much. A little bit iffy, but yeah. First 2 ones were just fabulous, perfect, just perfect weather. All right, so let's talk a little bit about obviously this young lady who's coming on, Michelle,
Yes.
better known as Shelley.
Better known as Shelley.
Better known as Shelley. Now you're coming on. You're starting May 2nd, as Bill mentioned earlier, as you came in.
Correct. Many have already seen me in the office with Dr. Al and Terry, so I've had a little exposure in this role, but I've been in the Salem community for years now. I worked at Salem Hospital for 11 years. I did home health surgery, worked the floor, jack of all trades, master of none.
Well, that's okay. Hey, diversity. It's a lot of.
And in that, I raised 6 children.
You're busy. Talk about long hours.
Without a doubt.
I don't want that down.
Gave me a lot of life experience.
I bet you did.
No wonder she worked all those hours.
Now, obviously, we all know about Tiffany now. Tiffany's your daughter.
Yes, Dr. Bland is my daughter.
And Tiffany has come on and done a tremendous job. And anybody that needs a new general practitioner, she is a great one to go to. Dr. Al's my doctor, but I talked to Tiffany, and I think actually she had 2 new patients when she went out the door before she ever got out, which is great. But,
yes,
if you need definitely want your medical services local and you want somebody that has all the qualifications to get it done, contact SMDH Family Medicine. And you are a nurse practitioner.
Correct. I am a nurse practitioner. Not just a nurse. And people don't really understand there is a difference between a physician and a nurse practitioner. And raising a physician and watching the schooling that she went through and going through the schooling that I did go through, there are differences, and there are times that you absolutely need to see that physician. And I'm proud that Salem has 2 good physicians that you can see, because in a small community, that's phenomenal. I mean, most of them don't have a physician to offer you because the shortage. And Missouri is a very restrictive state as far as your nurse practitioner goes. Right. And unfortunately, there's a lot that practice beyond their scope, So I just want to say that, there are definitely laws that we are governed by in our State Board of Nursing, which governs us. So,
yeah, they made some adjustments to the physician's assistant, the PAs.
Correct.
Here about 2 years ago that actually made them a little bit
more independent.
Yes.
Correct.
But for a lot of times they were totally dependent upon
yes, they were. Yeah. And so Kansas actually just became independent for nurse practitioners. So there's 26 states that are completely independent, but Missouri has yet to go beyond that. And like I said, they are one of the most restrictive states when it comes to nurse practitioners. So, and it's good to know your limitations as a nurse practitioner at this point in the state of Missouri, just to make sure that you're in that governing body to protect yourself.
Right, absolutely. But one of the things, obviously, watching your daughter go through all this and stuff.
Correct.
Obviously, you have a sense of community, as she does too. She's
Correct.
going to help. She's going to work with the Denton County Health Center on the women's program
Yes.
they have over there.
Yes.
And I think that's a fantastic collaboration between our hospital and our Denton County Health Center, and bringing that together, because there's just so many people out there. I think they get afraid of doctors or whatever, and then I don't really want to do that, or I can't afford this, or whatever.
Yes.
Hey, this is something that's very, very easy for them to use.
Correct.
And your daughter is the most non-threatening person I've ever met. I mean, she's about as sweet and lovable as she can be, but that's what it takes in many cases to get people to understand that.
It is.
I'm not here to tell you how to live. I'm here to see how
to
you're
guide
doing.
you. Yes. And that's just the thing. Medicine has moved away from taking care of the problem. It's moved to let's prevent the problem
there
now.
You go.
And it's all about prevention. And I myself, growing up in the 70s and 80s, you didn't go to the doctor unless you were sick.
Really
I mean,
sick,
or,
yes.
The emergency room. And I want to say in this area, prevention is so important because we don't have the resources. So to prevent that heart attack is much more appropriate than to have to try and treat that acute heart attack. So, I mean, that's where I have learned and my eyes have been opened. And people don't use healthcare, like you said, it's a little bit different culture here. You know, we do like the natural remedies, and we're all for the natural remedies. You know, everything can work in conjunction to emphasize good health.
Well, what, you know, and you don't mind Shelley taking over a little bit of your...
Not at all. Not at all. Go for it, Shelley.
Well, you know, I mean, she is on the list.
I have the gift of gab.
Let me just suggest this. If Shelley were here and Tiffany were here, Tiffany wouldn't get a word in edgewise.
She probably would have said hi.
Well, Tiffany, you know, I told Bill that it was an acquired thing for me. I was very quiet, very awkward. And through life, I have developed my gift of gab and love for people.
Well, it was very interesting when I interviewed Shelley when she was finished up her program, and she came in and we talked for a while, and she left, and I said, I just kind of shook my head because of having dealt with Tiffany for a bit. Yeah. She was so quiet, and then Shelley was just out there.
Yeah.
And I loved it.
and it's fantastic that mother and daughter can actually be in the same hospital and working together and work in unison. One of the neat things that I like about the hospital, and if people don't understand, I'm kind of one of these guys that don't give me a prescription to cover the pain.
Correct.
Let's find out why there's pain.
Right, exactly.
You know, and that's always been my theory, and that's not always every doctor's theory that you see out there.
Right.
You know, but that is Dr. Al's theory, and because I know when I talked to him, and he said, we're going to give you this, and this is why I'm giving you this.
Yeah.
You know, don't give me this to cover the pain. Give me this and tell me why you're giving it to me to either reduce inflammation or whatever it is, so I can get back to this level and do what I need to do.
Right. And unfortunately, you know, that has been the course of medicine, and that's how we've gotten into the opioid crisis, because people come in with pain, and instead of trying to figure out where the pain is, you know, we think we're saving them by not doing the diagnostics.
Right.
And theory, we're not. You know, we're getting them addicted to opioids. We're getting them addicted to benzodiazepines. A lot of people are not even aware that these are addictive medications, you know. And what makes them addictive are the side effects when you try to get off of them, you know.
Right. So if somebody would hit your toe with a hammer, you know, you can give them all the medication you want, but that toe still needs to be corrected.
Correct.
You still got to fix it.
And the thing with addictive medications is you do develop a tolerance, and eventually it doesn't work.
It doesn't work.
And then
take more.
Yes, exactly. Exactly.
Yeah, it's a vicious cycle. So the best thing is to find out, okay, if somebody gives you a medication or you go into the doctor, and we always try and explain this, especially when we have interviews like this. When you go to the doctor, tell them everything. Write it down before you ever get in there, because you're going to get in there, you're going to forget.
Right.
You know, if you have a problem, if maybe you have something in your back and you've had this pain, it constantly comes to and from, you don't know why it's up there, or maybe something in your shoulder. And you get there, I forgot to talk to him about it.
Right.
Then you don't see him again for 6 to 8 months. And you've had this pain, it comes right back. And,
yes.
You know, they don't know about it. They can't fix it. And then they say, well, my doctor didn't fix my shoulder. Did you tell him about it? Well, no. Well, you expect them to just know your shoulder?
Exactly. And then, too, what people don't realize is a lot of part of our treatment goes along with insurance requirements.
Sure.
You know, there's some things like the MRI. A lot of times we can't just jump into that in primary care. We have to jump through those hoops to get things covered, because that's watching out for your bottom line. You know, if we don't go by the rules,
Sure.
and then you're required to pay for that MRI because it wasn't covered,
Right.
because we didn't do our part of it, then, you know, that's on us, bad us for not knowing.
Well, that, and I remember, what was it, 10, 12 years ago when they changed the amount of codes. Well, was it 60, 16,000 up to 63,000? And I thought, are you kidding me? It's just a way to find a mistake.
Yes.
That you don't have to pay.
Yes.
That's what it looked like to me. And I thought, I don't really think we need to go into that much detail. If I need an MRI on my knee, I need an MRI on my knee.
Correct.
I shouldn't have to ask 15 questions as to why I need an MRI on my knee.
In a good world, and it would happen, but it just, like I said, there are also insurance guidelines that we have to abide by just to help our patients.
Absolutely.
You know, and so, like, if it means multiple visits, then by all means, make that appointment. You know, don't think that we just brushed you off and we're not addressing this issue. We are. We just have to go by what we're required to do to get it covered. So
And it takes time.
And it does.
Yeah,
But
sometimes
and
you-
persistence.
Yeah.
You
And-
have to be that squeaky wheel.
And Shelley, if I might say, if a person has an issue with their insurance company, call them.
Yes.
You get on the phone. You're the one paying the premium. And if they're saying, well, you know, if the hospital says, we have not gotten a response from your insurance company, we are waiting on them, then you call them.
And call your representatives
Yeah.
and call your senators. I mean, those are the ones that are governing this.
Because, you know I had to call Anthem and I thought, what's going on? This is supposed to be covered. Well, we haven't gotten any word back from the hospital. I said, I'm sure you have because I've already talked to the hospital.
Yes.
Well, it's not in your file. I said, well, find it. You
Exactly.
and don't let them off easy because they'll give you, well, you know, we're checking into it. No, you check into it. And I want a response from you by tomorrow.
Yes.
You get some
Give
kind of
them a
response.
deadline.
Yep, you get a response, get a name, get somebody you can go back to, because if they're holding out medical care for you, which is totally against their ethics,
Correct.
then you got it. Now you have a case to go against the
Yes.
insurance company. But for the most part, sometimes it does take a few days for them
Yes.
to take a look and see, and maybe they need another test. You might get an MRI. Maybe they say, hey, you know what? We don't see enough there. Can you maybe you need to get a different one?
Right,
Or
yes.
Maybe they just took the wrong picture. Wrong knee.
Correct.
That does happen.
Or maybe it's referred pain and we need to get a test of your back when we thought it was actually just your
There you
leg
go.
or your
There you
hip.
go.
So,
Very
yes.
good. Very good. All right. Well, let's kind of move forward. All right. But thank you
Yes.
so much. We'd love to have you here. This is fun. I'm glad she doesn't say anything.
I know, yeah.
You know?
Between she and Joann, I don't get a word in, I can assure you.
Well, it's okay.
It's okay.
She kind of knows what she's talking about. So that's the kind of thing. So obviously, marketing, community perception. I know one of your big goals was to make sure the hospital is very visible in the community, and they have done a tremendous job of getting that done and getting back to that state they used to be, and now they are again.
That's correct. Yeah, we actually put together a marketing committee this last week, and Karen Brown is actually heading that up for us now. Karen is going to go back into semi-retirement here in the middle of May, but she's picking up like a community ambassador role for us through the Delta program,
Okay.
and she will be our face in the community, if you will, that will be represented in the hospital. So, yeah, we're going to be much more visible on Facebook, the website, radio stations, the newspaper, that type of thing, because we didn't have the money for a while to do that, but we've got a little money now, so we're able to be much more visible. So,
And doing a frugal way.
absolutely,
Yeah.
yeah, making sure that we're just reaching the audience out there that for the things that they want to hear about for the hospital.
And the things that are important. I mean, we do have a lot of great things at our hospital that, you know, including a brand new nurse practitioner.
Yeah.
I'm not mentioning names, but she is kind of here, you know, and her daughter. And, you know, we really love to be able to tell people about these new people that we have,
You bet.
or people that have returned to the hospital, coming back, and about the services that the hospital offers. I can honestly tell you there's a lot of people that didn't even know Salem offered a swing bed.
Yeah, oh, that's
Didn't
right.
even know
Yeah,
about it.
Yeah.
You know,
Yeah, it's swing bed is kind of one of those acronyms that people go, yes, swinging beds in your hospital.
yeah, absolutely. Boy, you have a great time with it.
And it's always nice to get your loved one closer to home.
Close to home.
right.
Because if you've
Absolutely.
ever had a loved one in the hospital and you live in Bunker or Eminence or
Are there in St. Louis and you're in Salem?
yes,
Yeah.
yes.
Oh, that happened with my dad. Yeah, that was not fun. I all but brought him down here
You bet.
because after what I went through in St. Louis, that was if he had gone one more time, it'd have been here.
Correct.
Yeah.
Yeah, not a lot of fun. Don't have to do that. So anyway, well, we all know Karen. Karen's been around. Well, she's gonna take a couple of weeks off. I understand. Here.
She's on our way to Florida as we
Yeah.
speak, I believe, this
I
morning.
talked to
yeah.
her and she
Yeah.
said she was leaving. I said, seriously? I said, you went into retirement for all but 6 months? And
Yeah.
you know, now you're taking off again?
Well, we got that mother-daughter thing going again, you know.
Yeah, I know.
Her daughter is now the executive secretary, so
But then-
it works out well.
But then she called a vacation going ice fishing in Minnesota.
I know.
I mean,
I knew she wasn't well when she told me that.
That must have been at the urgence of Dr. DeMorlis.
Yeah, absolutely. Yeah. Now
Yeah.
they're going to go to the beach. So yeah.
so as you're saying with the marketing community perception, obviously Health fair has always been a big part of that. We know we're looking forward to getting that done. Chamber Expo will be in
Correct.
June, and you guys will have a booth there.
We will.
And I like when Ladies' Night Out is held. The hospital always has a number of different booths there as well, with breast cancer awareness and different things of that nature. And then with the fantastic 3D mammograms that you can get here, which you cannot, by the way, get that in most hospitals around this area.
That's correct.
Except Salem.
Yeah.
I'm not saying. Maybe I am saying. Okay.
Schedule your appointment.
Well, yeah, call Bree.
There you go.
Yeah, make that appointment. But stay on top of these things. This is the kind of services you have here that you're not going to find in many places, especially the size of Salem. It's just not there.
Yeah, that was one of the things that impressed us when we came in February was the degree of equipment that we had for the hospital. You don't see that in a lot of hospitals, but this one is very, very well equipped.
Yeah, very well equipped. And improving even as we speak with that new CT coming in.
That's exactly right.
When is that coming
It's probably
in?
going to be 90 days before we get it. Everything is backlogged. It's like everything, supply chain is just broken.
But it will save the hospital money.
It will. Yeah, we're
A
going to
better machine would
save
save
about $20,000 a month. And I'm sorry, $20,000 a year.
I was going to say,
And,
that's not the numbers I have, but I like your numbers better. How about the Joann's over here going,
Joanne's
I
going
didn't speak up. I figured I better not.
I think they'd have to be paying you to say
That's true. But we're replacing the machine. I think it was bought in 2013.
Yeah.
And this one is certainly state of the art. And as Shelley said, it allows us to bring bigger patients. It's much easier on our techs instead of having to move that patient around. The equipment will actually do that for them now, so that'll be good as well. So.
In 2013, it's not an old machine.
No,
but
it's
this
not.
is so much better, and with the cost savings to go along with it.
Yes.
Yeah.
All positive for the hospital.
Yeah, the technology changes pretty quickly.
Okay, so the lab update we've kind of gone over. Clea is going to be in a couple of weeks. Anything further on the Delta Regional Community Health? I know that Tabitha's
really.
in charge.
Yeah, everything's moving forward. We had our first executive meeting with them last week, and it's a phenomenal program, and it's something that it's a 3-year program, as everybody I think knows, and it's something that we get fully engaged in and get a lot of members of the hospital engaged in the community as well. And it's a program that will just look at our hospital and help us, along with RHG, kind of fine-tune some of the things we're doing. And I've seen it happen in other communities, a group called Stroudwater that's assisting us. Phenomenal outcomes. And it really helps position small hospitals for the future.
And being Delta Region, it gives you a lot of input from a lot of other hospitals in a similar situation as
That's
Salem.
correct. Yes, it certainly does.
So you can learn off of the diversity that you get from them as
That's
well.
right. Sure can.
Nothing wrong with learning something. I always
Nope.
like that. That's good
Yeah,
stuff.
man.
All right, very good. So we have a lagoon. It's a beautiful lagoon if anybody likes to go out there. I wouldn't recommend putting a picnic around it, but
The turkeys like it.
yeah, the turkeys do. I'm not sure why, but we do have a lagoon. The hospital has been part of the city expansion with their wastewater system, putting a sewer out that way. But can't hook in. Well, you can hook in, but the lagoon closure that has to go through DNR.
Right.
This is a process, isn't it, Bill?
It is. It is. It's a lengthy process. We're ready to hook up to the city sewer, and we're visiting with the city now on how to make that happen. And then at that point, then we've got 90 days to have a plan to DNR to close that lagoon. So we're working through with that. We're not sure of the cost yet. It won't be inexpensive, of course, when you do those. But
It was $175,000 to get it redone,
yeah, exactly.
and when it's supposed to cost $35,000.
Yeah.
Kept going up. No. DNR new rule. Oh,
Oh, absolutely. Absolutely. So, yeah, you'll hear more about that in the next few weeks. And
I'm sure.
Todd Workman is handling that for us.
Speaking of Todd Workman, by gosh, he's a nice guy.
He is.
I haven't seen Todd in a long time.
He's,
Though. We need to get him back down here.
He's one of the best maintenance supervisors I've ever been around in all my years. He's a great guy.
Todd's a good guy, and I mean he'll be on top of this lagoon closure like you can't believe. But we also have a transformer out at the hospital that's had a few years of service.
Just since 53. It's 53 years old, so 1970, I guess. And, we're in the process. They're working through all the planning right now. I think we should Put it out to bid in May, and hopefully by July we will be able to have the intercounty come in with a new transformer, put that in for the hospital, and then we've got to do all the work behind that, behind the scenes, to run all the wiring, et cetera, to get that hooked up. But it's probably close to $500,000 project when you get it all tied in.
Well, those lines are running over the hospital currently, right? And you're not going to have that happen.
No,
You're going to be rerouting those lines, and that's going to cost some money. And then most of that's going to have to probably be underground.
It is, yeah. And fortunately, they were forward enough thinking, the hospital was, with the city to actually bury those PVC pipes earlier. So we're ready to put those wires into those. But we got 10, I think, 4-inch, 3 or 4-inch.
4-inch pipes.
4-inch pipes, 10 of those, and they will be full of wiring when we finish. Because when you try to make sure you've got power to all the hospital and make sure your generator's able to back all that up,
right,
it takes a lot of wiring to do that.
Absolutely.
And wiring is not very cheap.
Oh gosh, no. If you can get it.
Yes.
That's true. If you can get it.
If you can get it. So hopefully we will be able to get what we need to have in. And even 90 days, we put a new FM translator up. We were able to get our coax in. But then I was talking to the gentleman who was our agent that got everything done. He said, he goes, you're lucky you got your order in, because 3 weeks later, when you ordered your cable, it was a to be determined.
Wow.
It's already an 8-month delay in getting your cable. And I thought, you get a construction permit, it doesn't last that long.
Yeah.
And they said, yeah, well, good luck. And you can ask for an extension. But if you can't get it, you can't get it.
Well,
Could you imagine going to the doctor and they said, well, your deductible or your payment's going to be to be determined. We'll tell you later.
Yeah. Well, and that was just the availability of it. You don't know what the cost is going to be,
right.
and so you're trying to put a budget together and you just simply couldn't.
Well, and most of these contractors now, they're giving you a bid that's good for 15 days.
Yeah.
And because they don't know what their prices are going to be in 15 days.
Well, I don't know if you heard yesterday, the cost of a new house, went up 15% last month.
Oh my God.
15%.
Wow.
So they said a $340,000 house has already gone up to $379,000.
Wow.
It's the same house.
Amazing.
It's the cost of materials.
Yeah.
I think it's just gone up that much in 1 month.
Right.
Well, add interest rates to that.
Don't do that. Joann, you're supposed to be the positive
She's all
girl
about
here.
finances.
Man, oh man. You brought her along to be positive. Throwing insurance in.
We were the talk of Easter dinner when we said we spent $75,000 on our house.
Yeah. Well, it is what it is. Not much you can do about it. But Lagoon, something's going to happen. The transformer, something's going to happen.
Yep.
So these things will be going on probably all summer long. We'll be talking about it. And sooner or later, they will all be complete.
Well, those two issues and the CT are probably the big items right now that are going on as far as infrastructure at the hospital.
All right. So you introduced the board to Jennifer Smith in revenue.
Mm-hmm. Yeah, Jennifer has been with us now for 6 weeks, I believe, and
Okay.
Doing a phenomenal job on the revenue cycle end of it. As Joann said a few minutes ago, we were able to collect $2.2 million in March, and they're well on their way to another $2 million collection rate this month as well.
That's
so
fantastic.
Good to have her on board. Certainly
I
is.
look forward to meeting her next time. So hold meetings when I can go.
Come on over anytime.
Well,
I'll buy you a cup of coffee.
all right, there you go. And
It's
that's
baseball season.
Yeah, well, that's about another 4 weeks, 5 weeks, somewhere in there, and it'll all be done dead. All right, David Curry was in here the other day. We interviewed Davey, and he's like, we just sit there. He goes, "What do you want to talk about?" I said, "It's up to you. You're the pharmacist." He goes, "Now COVID's over. We don't have to worry about that."
There you go.
But we talked a lot about vaccines and different things of that nature. And one of the neat things right now is that he's working on a program for kids right now with the 340B program and all that. How does all that work? That's way above my pay grade.
Yeah. Well, I think the vaccine for children program is something Tiffany actually suggested we get involved with. When I first came in, she said we need that program here.
Well,
So.
Yes, and it's really, integral for parents who bring their kids in for visits, for us to be able to provide all of their care,
right.
not to have to go here and there. So, yeah, that's the whole idea behind that is that we don't want you to have to go any further than your primary care.
One visit should
Right,
do it.
one visit, one stop shop.
Wow, we've got a new marketing person. You better let her loose.
There you go.
She-
That scares me a little bit.
I can imagine. But it is true. And then the savings. There's also savings that can be involved for some of the employee prescriptions. Is that
Yeah,
true?
our prescription costs right now about $60,000 a month.
$60,000 a month.
Yeah. So the 340B
That's a lot of
program,
money.
It is
it's a lot of money. Yeah. And the 340B program was designed for nonprofit hospitals, specifically rural hospitals.
Sure.
And we're going to try to roll that out here in the next probably 45 days. And the employees will be able to buy their scripts through the hospital at a very, very significantly reduced price.
But they were using a 340B for patients, were they not?
Yeah.
But they weren't doing it for their employees.
No, they were not. I think maybe they had it years ago.
They
here,
did. I
is what
remember when I was there previously, we had it, and then they took it away, and it was a great benefit. It was really sad to see it go. So yeah.
So I think employees will be very, very pleased with that. I mean,
Very good.
If you got several $100 drug, we can buy it now for 5 or 6 cents. It's crazy. I don't understand how that happens,
Yeah.
but yeah.
I'll bet not. So, well, that's a great idea. I like that. And then the inpatient medication discharge counseling.
That's we have 2 pharmacists on staff, and they've been sort of busy, so they haven't been doing that in the past. But we've reinstituted that now. So
Yeah.
if Shelley has a patient in the hospital, then we have, if she wants to do a consult with the pharmacist, he will go down and talk about the medication the patient's going to go home on, and that way they understand completely before they go home. Because the providers they're seeing several patients a day in the hospital, and
Right.
the pharmacist has a little more time to spend with them talking about their medications. So it's a good program.
A lot of fear in taking medications anymore.
Absolutely.
You know, we've already talked about it, of getting addicted, or how potent they can be, or what the side effects might be. And I think some people get very scared of taking
And
their
there's so many
medications.
new ones out there. I mean, we have come a long way in medications, and like just in your diabetes, insulin has always been the treatment for diabetes, but now we're coming out with medications that actually jumpstart that pancreas back into functioning, even though we thought in the past that was not possible, and now we're like really moving forward there too. So it's really good to have that knowledge, or that knowledge base, or somebody to turn to and say, hey, what's my best option here? Instead of going up and up and up on this insulin, is there another way that I can address this problem?
Right. It's always better to take less if
Yes.
you can get things working
Yes.
in a better situation.
Yeah.
And people don't understand that. Same thing with blood pressure medication. You're not exercising to just, I hate exercise. Well, we all hate exercise, especially when you start getting over 50. Like, why am I doing this? Well, you're doing it to stay healthy. That's why you're doing it. And really it becomes a big thing, because if you stop, you watch that blood pressure just keep ticking up.
Right, and the dangers of that is your cardiovascular
Right.
disease, your kidneys.
Kidneys
Everybody
shut
forgets their
down.
kidneys.
So, there's just too many things that you don't want to put to chance.
Right.
I'm not saying that can't still happen. It can, but
Yes.
why not just do a few things to keep yourself in some kind of shape? Watch yourself and just
Yes.
prevent.
Prevent.
General easy things to do. Walking around the block, go to the track, walk the track, come to the baseball game, watch the announcer, walk around the baseball field 15 times, But there's so many different things that people could do. You don't have to go run a marathon, but if you want to run a marathon, by gosh, go do it and make a goal of it. I think people lose track of, and Shelley, you can possibly answer this question, is a lot of times that I have seen, and I've talked to different physicians, and they say, well, you need to exercise. That's not a solution. Nobody knows what the exercises are, or how to do them correctly to meet what the physician is telling them to go exercise. Does
Correct.
that mean run, do sit-ups,
Yes.
do crunches, go in the weight room and start pumping iron?
And like
They
you
don't know.
said, like once you get over 50, weight-bearing exercises are very important, to maintain your bone health, so like I said, it is important to be able to know what exercises to do. Cardiovascular, say you have a bad hip, or knee, you know, an elliptical, something that's going to be a little bit easier on those joints, or the recumbent bicycle. And that's also where physical therapy comes in, you know, like, so you're doing your weight training, and guess what? You throw a shoulder out. Physical therapy can help you in figuring out exactly what muscles you need to work out. I lift the little weenie weights. Repetition counts,
that's
guys.
Right, it does.
And you know,
take that 3-pound weight over your head 150 times. You better know it does.
Well, and then I had a shoulder injury. I had good deltoids, you know, but I wasn't working this one little muscle here. Physical therapy is like, you got to do this. And I'm like, I can't do that. I don't think my muscle is supposed to move that way.
Yeah, it really is, but you just haven't done it in 35 years. You know, that's what happens with 6 kids. You just like,
I was in that 80s stage. My kids remember me doing all those crazy jazzercise and aerobics. Donna Summers, you know.
You may have to explain who that is to a lot of people. I think. No, but it is true. When doctors and them say you need to exercise, I think a patient needs to say what kind of exercise.
Correct.
What do you want me to do, or what do you see that I need to do? And if they say, well, we need to build up your cardio, okay, then let's start walking, then maybe jog, hit treadmill, hit the elliptical, do something to get you breathing a little deeper, a little bit more.
Right. And what people don't understand, exercise is vital as far as like our cholesterol components, you know, our triglycerides, those crazy triglycerides. The only real way to get those down, avoid the carbs and exercise. The HDL, which is our good cholesterol, the only way to really change your HDL is exercise. And that's where your cardiovascular exercise comes in, is to bring that HDL level up. So
Absolutely, and there's a lot of different ways to exercise. So
there are.
We have a wonderful fitness center here in town. Bill just visited.
Yep, I did.
Number of different ways to get going. And yeah, the younger you are, you might be wanting to play basketball. The older you are, you may want to
just go to some of those dance classes that Healthy Dent County has.
You can do dance classes. That's great. Yeah, they work. Yeah, I like to cut grass. Okay, people, and I have allergies to grass, but I like to cut grass. I've had people tell me, "Why do you keep cutting the grass out the tower? Why do you walk an acre? Why do you do this?" Years ago I played sports, and when I perspired, and then when I get done perspiring, I take a shower. I felt great.
Yes.
All the toxins are out of your system.
Yes.
Everything's good. You know, everything is good, and anything's clean, and you're breathing good. And
yeah, you know, Dr. Bland was a star player and bunker on the basketball team.
Yeah. And when you do those so cutting grass to me gives me, first off, 2 things. 1, exercise. 2, I get a chance to think.
Yes.
There's no phones. There's no nothing.
Yes.
You're walking, and you get a chance to take pride in what you're doing, but also you just get a little time away to think a little bit. And that is just as healthy as the exercise you're getting.
Exactly.
Take that stress off.
Yes.
So
it's a lot better than smoking.
Well, I don't, but I have seen people smoke when they cut grass. I don't think that's the wisest thing to do. But I mean, you can do it. I guess it's acceptable.
Good stress relief. I like to run, so that's my stress relief.
I used to run, but my knees
Your joints,
my knees don't want me to do that anymore.
Yeah, that high impact is hard on the joints.
That it is. Okay, so let's move forward. I know you guys all have to get back to work, and I don't have to do anything until I have an afternoon ball game today. But we did a couple different things. Obviously, we got a new CT, and that was actually priced out for our board.
Yes, it was.
And they did agree to lease that. I guess it's a lease purchase, right? We'll ask Joann because she knows all. Right, Joann?
A lease purchase with $1 buyout. So.
All right, very good. And Joann has a nice little folder that says, "Yes, I do talk to myself."
Sometimes I need expert advice.
And I'll tell you what, if you can't trust that person, you know who you can trust. Yeah, we have employees here that do a lot, and they talk to themselves while they're in the same room with each other, and that is really confusing. However, so the CT was approved by the board, and then you also did a podiatry power equipment. I don't have any idea what that would be.
Yeah, they're hand instruments. their saws and that type of thing.
Oh, okay.
Some of those toenails need it.
We had some equipment that was old that just kind of wore out, and we don't do a lot of that, but it was things that we use 3 or 4 times a month. So
Okay.
the board approved that for us.
All right, very, very good. All right, so as we talked about the transformer stuff, we do want to remind everybody that at the transformer, the hospital did make a presentation to our county commission to help pay for that transformer, which is going to be a major expense. And in recovering right now, our county was wise enough and honored enough to be a part of that and allowed the hospital to use some of the ARPA funds that will be coming their way.
Exactly. We're very, very pleased and thank the county for that. I think we're allocated $200,000 for that project, and it's going to take all of that plus a lot more to get that project completed. Right. But if hopefully if we run into a problem with funding, that we may be able to go back to the county. So
yeah,
certainly appreciate that.
They know how important our hospital is, and of course it's not just them saying yes. There's still a lot of paperwork that I'm sure Joann's going to have fun with. She'll be in touch with Kelly Sink at MRPC, and they'll get all the details. And it is crossing of the T's, the dotting of the I's, because it is government money, and they will make sure you do everything to their specifications.
Yeah, Kelly came by day before yesterday, and we visited with her, and she had a pretty good sized packet for us to take care of.
Well, like 6 inches thick.
That's okay. We'll do that.
It takes a while to get through that. Yeah, but anyway. Besides that, I don't really think there's anything else. You went into closed session. Any votes taken in closed session?
I don't believe there was, no.
Okay, not that we can report. Well, very good. Well, first,
anything you want to add?
No, not really. I think we covered quite a bit in this little session.
We
but
always try to cover as
yeah,
much as we can.
Like I said, just feel free to
though,
make an appointment.
Well, that's my thing. We do want to remind everybody, you will be starting May 2nd. You'll take patients May 2nd. Right?
Yes.
Okay, as it's starting May 2nd, and your days that you will be there.
I will be there Monday through Wednesday, and I'll be off on Thursdays, and then I'll be back on Friday.
Okay, so Monday through Wednesday and Friday.
Yes.
Over at SMDH Family Medicine.
Correct.
729-8000 is the number to call, and just tell them that you would like to go to that quiet one.
If nothing else, maybe you'll go out feeling better.
Yeah, you might want to say you'd like to go to Shelley, and then they'll schedule you in that way. And walk-ins are always welcome as well, and then you guys can work your magic that way as well. But SMDH Family Medicine is right there on campus, and if you need something done, you're right there.
Correct.
Very long
and if you're
done.
sick, we'll take you. We don't turn you down. So
that's right. So come on in. If you,
I think our goal, Shelley, is we're seeing about 60 to 70 a day right now, and our goal by June, I think, is 100.
So I need about 40 patients a day.
She can
no problem. I'm sure,
With her energy level, she may say 50 a day.
You're going to be a busy girl.
But I like to talk.
Yeah. Really? We didn't notice that. Now, one of the things that if you haven't something going wrong, if you're not sure what it is, anything, and people just don't understand. It doesn't like you wake up in the morning and there's something written on your mirror like, hey, get your gallbladder checked. It just doesn't happen that way. If you feel something weird, if something isn't normal, pain here, change in your normal bowel movements, anything. I mean, anything that you can't explain, with Mexican food or Chinese food or anything like that, you definitely want to make sure that you get it checked out. Shortness of breath. A lot of people say, well, it just suddenly came on me. Then suddenly get to somebody and get it checked, because there shouldn't be a sudden some kind of shortness of breath or sudden pain here. All of a sudden you have problem one way or another with feeling in your hands, anything like that.
Yes.
You should not encounter that all of a sudden. Over time, maybe, but still
you should get it checked out.
Yeah, you should get checked. And I always recommended getting a physical once a year, no matter what.
Yes, and that's where we talk about the prevention part, Come get a checkup once a year. Let us know your baseline when you are feeling well. Everybody's baseline isn't the same, so.
Sure.
Yeah, exactly.
But one thing that I really wish that everybody would do who's a patient, we would go there and talk to your nurse practitioner or your doctor and speak to them and be honest with them. Tell them what the problem is. Tell them that you've had this for 2 weeks. Tell them, whatever the symptoms are, try and jot them down. Again, don't assume it's going to go away. It may not. And if you knew it happened starting April 1st, and here it is the 20th, and you're still having it, they need to know that.
And don't be embarrassed. I mean, people have body parts. We've seen it all.
Yes, you probably have. 6 children later, you've seen everybody. I'm sure.
My husband always teases he could deliver one.
I'll bet he felt that way. But be as honest to the physician as you can. Let them do their work, and they're going to ask you some questions. They may be very personal questions too. Don't be afraid to answer them. They're not. It's not like this is on TV and you're not going to see it at 9 o'clock the next night. It's not going to happen that way. This is all private, and it stays private.
Correct.
And so if you have an issue, please go in with the right attitude, not defensive.
Yes.
Be in there to get the problem solved. And
right.
I think that's always been my philosophy when I go to the doctor. And I try and joke with them and have a good time. But sometimes there's things you don't joke about.
Yes.
And I had a kidney stone. I didn't joke about it. I went in there and said, we need to do something. And he kind of laughed. He said, there's really much I can do. He said, it's gonna hurt for a while. I can just tell you. I mean, he did give me a.
Well, I have a funny story. So I do have a 9-year-old yet, and I went home and he said, "So, Mom, did you guys do any heart surgeries today?" And I said, "No, me and Dr. Al haven't gotten to that yet, but we will."
A couple transplants, but no surgeries.
That's great.
Yeah,
about the babes.
Yeah, you just never know. Well, again, we want to thank all of you. Joann, it was a pleasure meeting you, and I'm sure we'll be talking again many more times, and I'll be seeing you at meetings, I'm sure, right?
I will be around.
All right, very good. Shelley, as always, I just wish you had something to say. I'm so sorry you're so withdrawn, but we'll work on it. And Bill, it's been a pleasure having you in town, and we look forward to seeing you in your excursions back.
Absolutely.
This will kind of probably be the last one of these you'll attend.
It will. Yeah.
So
unless I'm in for the board meeting, I'll probably see you. But yeah, I'll be back and forth.
Well, very good.
Absolutely.
Our friends in the Salem Memorial District Hospital. Remember, your hospital's here for you. And if you have any questions about setting up an appointment, again, 729-8000. If you have any questions about the hospital or about the golf tournament foundation or anything else, maybe even the CT scan that's coming in. If you have questions, Bobby will probably be bragging about that one. Or the MRI, you can call 729-6626 and ask for the proper department. They can get you right there. As always, thanks again.
Thank you.
All right.
Appreciate it.
Appreciate you guys coming in and spending some time with us here on KSMO Radio. We have Civic Happenings coming your way next in a moment.
Liberty Mutual Insurance Company presents and Doug.
Check it out, Limu, a roadside carnival.
Step right up, folks. Test your strength. Come see the fire-breathing baby.
Let's fan out and tell people that Liberty Mutual customizes your car insurance so you only pay for what you need.
Look! An emu wearing sunglasses!
Limu, you're famous. Only pay for what you need.
Liberty, 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 liberty.
Hi, I'm Lisa Delaney, swing bed coordinator at Salem Memorial District Hospital. What in the world is a swing bed, you might ask? It's a Medicare program that allows a patient to remain in a hospital and receive therapy or skilled nursing services prior to going home. Call 573-729-6626 for more information about using a swing bed to improve your life before going home. We are committed to every patient, every encounter, every time.
There's a place for do-it-yourselfers with everything for your car or truck.
Right now, K&H Auto Supply, your Parts City Auto Parts store in Salem. You can save 15% when you purchase brake pads and rotors, or 15% with the purchase of Brake Best Select or Import Direct brake pads and 2 rotors. K&H Auto Supply, your Parts City Auto Parts store right here in Salem.
Parts City. Yeah, Parts City. Parts City.
Have a lake or pond on your property? Has the fishing been not as good as in years past? Or do you have a new pond you would like to get stocked? Country Fish Farm in Salem is here to help. They can customize the stocking to fit your needs. Whether it's a new pond or an old lake, they can stock them all. They also sell lake and pond aerators and fountains to protect your fish or add a touch of class. Give them a call at 729-4383 to get scheduled for their spring season. That's Country Fish Farm, 729-4383.
Good morning. It's now time for a look at our civic record. It is a program of church and civic news and a mention of persons recently deceased. The civic record being brought to you as a courtesy of all of us here at KSMO Radio. And your friends at Wilson Mortuary, a proud tradition of family service in Salem, Denton County, Iron County, and in Viburnum. If you have any questions about funeral arrangements or services, call Chris Hendricks, 729-5555 in Salem, or in Viburnum at 244-5554. The Wilson Mortuary is a proud tradition of family service, as we mentioned, where services are as unique as life. We're proud to say we have no funeral announcements to pass on to you at this time here in our civic record. That's great. Let's move on. Join Laura Miller and Kurt Furnow for a tie-dye class that'll be held today from 4 to 6 at the Creative Arts Center. Participants will be introduced to a variety of commonly used styles and patterns for tie-dyeing. With the use of bands and bold colored dyes, you can create a pattern as the instructor will demonstrate. You can do a bandana, that'll cost $15, or do a t-shirt or a wall hanging for $25. All the supplies for the class that you need are included. For more information or to register, call 247-0651, message them on Facebook, the Salem Arts Council, or email them, salemartscouncil@outlook.com. That's SALEMARTSCOUNCIL @outlook.com. Salem Public Library invites the public to a book signing at the Public Library today from 5:30 to 6:30 by Shannon County author Mark Van Patten. Patrons of the library will be able to chat with the author about the book Moonshine and Watermelons and Other Ozark Tales. Public Library invites the public to a book signing today, 5:30 to 6:30 by Shannon County author Mark Van Patten, the author of Moonshine and Watermelons and Other Ozark Tales. Jason Lott, the superintendent of the National Park Service's Ozark National Scenic Riverways, headquartered in Van Buren, is going to be the guest speaker at the Denton County Historical Society's 2022 Speaker Series at the Salem Community Center at the Armory this evening at 5:30. Lott will take questions from the attendees after he gives updates about the current and Jacks Forks rivers. The event is free.